Hi, I'm Ilana Gersten here with NUTV News. Today, Northeastern University announced that they will be transitioning to online classes due to fear of COVID-19, otherwise known as coronavirus. We're going around today to talk to students to see how they feel about this decision. What are your thoughts on transitioning to online courses starting tomorrow?
I think it was actually like a great call from Northeastern, especially that Harvard yesterday declared moving online, and I saw that the World Health Organization also just declared like a world pandemic. But that being said, we are so close to the end of the semester, so many people are graduating on co-op. I think it's definitely not going to be an easy situation nonetheless, but I mean, rather safe than sorry.
So I'm graduating fifth year, so I've been in a lot of classes. It kind of is no different than taking the online classes that I've taken in the past. I have a lot of questions, obviously, about how it's going to work, but I'm interested to see how it happens, and I respect Northeastern taking our health and well-being into account for the next couple months.
I think it's a very good move, and I'm surprised that they didn't do it sooner. I mean, so little is known about this virus as it is a new novel virus, and we don't know much about its mutation rate and how serious it can be, and the fact that it has been compared so closely to the flu is actually very toxic to the environment that we should be creating concerning a pandemic like this. And so by quarantining for at least 2 weeks, I think this is a very good move, just concerning the health and safety of everyone. And, we are well set up with, multiple platforms to go online. So I think this is good.
I think that's the right move right now, because given that Northeastern has a huge crowd and even the classes, so most of the classes in COE and CCIS have a huge strength in each class, and given the number of outbreaks that have just doubled from yesterday, I just read in the news that it's 1,000 already, and even the health officials have given in and they've been tested positive. So given all that, I think it's a good move.
I think that I definitely expected it because I think every other big school around us has. So I was kind of waiting for it to happen. I am kind of confused how it's going to work with finals and everything, and seeing how all of my classes adjust to it. I mean, it's expected, but also I think it's going to be a kind of big inconvenience. I don't really see how a lot of my classes will fit into an online setting. I'm just kind of anxious to see how that turns out.
We're both international students, and my biggest concern is that, one, we don't know if online classes will count if we take them, because international students aren't allowed to take, I think, as many as 4 classes online. And also time difference, and also now we're trying to figure out travel signatures and trying to go to OGS. So it's just a lot to do in such a short period of time. But yeah.
Basically it's a lot to figure out, and we don't really have all the information that we need, so it's just hard to make plans for the future without knowing whether anything's going to count, whether we're going to be able to travel, any of that. So yeah.
Are you worried at all about what's going to happen with graduation?
I have a lot of questions about graduation. Probably my biggest concern, and having gone here for 5 years, I was very excited for graduation, so I'm hoping that it's still on so that I can walk in the TD Garden and get my diploma.
Do you have just general concerns about the virus?
Yeah, I do. I actually work in an immunology lab, and, we do a lot of discussion based on this. And, for someone of my age and my health, I personally feel fine, but it's more that we are not set up globally, nationally, to take care of something on this scale. And again, we don't know enough about it we don't have vaccines, we don't have treatments that are in early phases, and yeah, we have the ability to make them, but these things take a very long time. So by doing things like self-quarantine and social isolation, we flatten out the rate of exposure and actually heighten our chances of creating more time so treatments can be made.
The amount that it's spreading, it seems like the rate is pretty concerning. I'm personally not too concerned because I'm a college student and I don't have any pre-existing conditions. But yeah, the amount that it's spreading is definitely concerning. I'm scared for the older population, and I hope that it doesn't really spread to them.
Well, I think it's all a little bit overblown. I think this will pass in just a couple of weeks.
No, I haven't been to any of the CDC level 3 countries, but traveling at airports and stuff I know is a big concern, and I know masks aren't the most effective preventative method, but My parents are like, if you're traveling, you better buy masks. So now I have to find masks, even though they're out of stock. So,
I am an international student. So, you kind of work on this milestone for 4 years of your life. And I really hope that, we can get to the point where we can kind of contain the situation, and that, family and friends, whoever come to graduation, it's still a possibility.
I guess I'm concerned because I work in like healthcare and stuff, so I guess I'm concerned about being exposed in places around Boston.
I have a lot of concerns. I actually work in the hospital system, so we have a lot of precautions right now. I am concerned about how quickly it will spread, but I would just like to remind people to just keep washing your hands. That's the best way to keep yourself protected.
I'm Ilana Gersten with NUTV News. Thank you for watching.